shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Kaz, in 1992, if I can ask you to think back to then, you were undergoing treatment for cancer, Hodgkin's disease. And in the course of that, you had 3 transfusions.
I had the first transfusion prior to diagnosis because I was 24 weeks pregnant and I had pregnancy-related anemia. And they did 2 needle biopsies in the month before that, in the February, trying to ascertain what was wrong with me. There was a lump in my groin, and the 2 needle biopsies were not enough. And so they needed to do a surgical biopsy, which I'd been resisting because I didn't want to have a general anaesthetic because I was pregnant. And finally I had to give in, and in order to get my haemoglobin up, they had to give me 2 units of blood.
And that was in March 1992.
That was March the 3rd, I think.
And then you had 2 subsequent transfusions in May 1993 and July 1993.
Yes, that was after 2 6-month rounds of chemo.
And I think it's also right that in the course of the treatment that you underwent for your cancer, you had a range of medical interventions, biopsies you've referred to, blood tests, Hickman lines and so on.
Hickman lines had 2 6-month rounds of chemo, so there was a Hickman line permanently in place for about a year.
Were you, at the time of any of those transfusions, given any information about any risks of infection?
Not that I remember.
Now, in 1993, you were diagnosed with hepatitis C.
Yes.
And I understand it around that time you also developed jaundice. What can you recall about that?
I was screened because I had 2 6-month rounds of chemotherapy that were not enough. I was then screened for a bone marrow transplant. Had I never had to have the bone marrow transplant, I probably never would have found out that I had hep C at all, but because they had to do intense screening. So just prior to the bone marrow transplant, I was told that I was hep C positive, and after the bone marrow transplant, I was seriously yellow and very, very ill with jaundice.
At the time you were diagnosed with hepatitis C, you obviously had a lot else happening in terms of medical treatment. You were about to have what you describe in your statement as a high dose of chemotherapy. Can you remember what, if anything, was your reaction to being told that you also had hepatitis C?
As far as I remember, I was told by my bedside in quite a matter-of-fact way, but a serious way. But as far as I was concerned, I was going into a bone marrow transplant room with 30 times the normal dose of chemo, fighting for my life. I had a 50% chance of coming out alive, and hep C was the last thing. It literally went in one ear and out the other.
Can I ask you then to describe how the hepatitis C began to affect you, both physically and mentally?
It's hard to separate it from the recovery from a year's chemo and then a bone marrow transplant, but I did start to pick up in the years after the bone marrow transplant, probably until around 2000. So I sort of was on an upward slope, and then I started to go on a downward slope with the hep C. I'd lost so much energy through all the cancer chemo and my bone marrow being suppressed through that it was hard to know what was happening, and I probably didn't give enough attention to the hep C symptoms because I thought I was still recovering from the chemo. But I began to lose even more energy and have dietary intolerances and brain fog and have to cancel plans, not make plans. Just chronic fatigue.
Can I ask you a little about the brain fog? You've described it in very vivid terms in your statement, and I wondered if you could give some kind of sense of how that affected you, how it felt.
It would be hard to connect the synapses in the brain. It would be hard to find words. You'd know what you wanted to say, but you couldn't find the words. I think I once described it as wading through treacle. You know, I've got quite a fast intellect normally, but it was just like wading through treacle, trying to make conversation sometimes. One time I drove a couple of miles to meet my daughter and her baby, and I had brain fog, and I was so poorly, and I got there at a play centre, and I sat, and I remember my granddaughter was very small. She sat looking at me saying, "Grandma, why aren't you eating your ham sandwich?" And I couldn't eat, I couldn't think straight, I had to go home early. And as I pulled into my driveway, I just smacked the car on the side of the driveway because my cognition was so out that I couldn't even drive properly. And it was my home, but I pranged the car. In fact, I pranged the other side a few weeks later.
And what about the fatigue, the chronic fatigue? Again, are you able to give a sense of what that was like?
The fatigue is so deep and so profound that no amount of sleep fixes it. You wake up in the morning feeling jet-lagged, feeling as depleted as you did before you went to bed. People will say, well, just go and have a rest, you'll be all right. And it doesn't work like that.
I think the way you put it in your statement, Kaz, is the fatigue was not helped by sleep, wasn't something you could push through. It was at times completely incapacitating.
You couldn't push
couldn't
through
even get
it
out
with
of bed.
willpower. I can remember coming home from art school. I tried to do an art course that I had to give up because of the fatigue. I remember coming home one day and having to go upstairs and just lie straight in my bed, and we had people coming around for a film night, and I couldn't do anything about it. I couldn't move, and I couldn't actually turn over in bed. I couldn't find the energy to turn over in bed. It was such a deep fatigue that it's hard to explain it.
And as these symptoms progressed, I understand you began to experience a range of other effects of the infection, fibromyalgia, a sense of near permanent flu. Is
I
that
had
right?
to stop going to yoga because I'd have muscle aches afterwards for days afterwards. If I did anything strenuous, if I did 20 minutes weeding in the garden, my arms would hurt for days afterwards.
And you mentioned digestive upset, not being able to eat, weight loss.
Huge intolerances and not being able to eat after 6 o'clock at night. I couldn't have onions. I'm still have to be incredibly careful around food.
And what about the effects of the hepatitis C on you mentally?
I think once I registered it and realised that it was something serious, once I was recovering from the bone marrow transplant, I think I just felt just really frustrated that I got through something as serious as cancer, and the cancer came back 5 years later. So I got through 2 life-threatening rounds of cancer, only to be given another life-threatening illness. So I'm a bit of a, not a why me, but a try me person, so I just battle through it anyway.
Can you tell us what the impact of this and of your infection was on family life? I understand it had a profound impact upon what you were able to do in relation to your children.
It was absolutely massive. My son, who's sitting here, who I was pregnant with when I was diagnosed, he was fostered out at 6 months old because of the cancer chemo, but the hep C impacted my energy so much that when I should have been recovering and taking my 3 children back and being a good mum again, I was constantly having to not attending. I didn't attend my daughter, who's sitting here as well. I didn't attend her graduation, which broke my heart. I couldn't travel from Devon to York at that time. The fatigue means you don't do so many things that you would like to do with your children, and you don't give them the quality of care that you'd like to give them. And because of the cancer and then the hep C, they were farmed out. Shay was in and out of foster care for years, backwards and forwards. We co-parented and we held it together, but it was hard.
And I think there came a time when you became a grandparent, but that the infection and the fatigue again impacted upon your ability to.
It meant that I
perform a
couldn't do
caring
the
role for your
childcare
granddaughter.
that she would really have liked me to have done, and sometimes she would read it that I didn't really want to.
And then more broadly, in terms of your private life and relationships, what impact did the infections and your illnesses and the fatigue have upon those relationships?
Absolutely massive. I was in a relationship when I first did the interferon treatment, which I tried in 2004, but because of my suppressed bone marrow from the bone marrow transplant, I only lasted 12 weeks on it. But my partner at the time was a keen paraglider and kite surfer, and we hadn't been together very long, and I don't blame him, but it was very, very hard that he chose not to stay with me. He chose to go off to kite festivals and to leave me to it. And with the ribavirin as well, which causes depression, I was in a very, very, very dark place for some months, and having to make a 2-hour trip to hospital every week as my blood counts were falling and I couldn't get treatment in the surgery in the village, so I had to keep going to Plymouth. And and him not being there for me was, and then
you subsequently married.
I subsequently married in 2006, and I was having some good days then, and was completely honest about everything. But over the months and years, my energy dropped away more and more and more. And more often he was working, and he was coming in at 9 o'clock and saying, "Come on, let's go for a drink." And I couldn't move. And it began to cause friction. And finally, I think in 2010, we separated, but we were still trying to keep our marriage together by not living together. And then in 2014, when I began the Epclusa trial, the clinical trial of Epclusa, we agreed to officially part. So I kind of set him free to have children, because I couldn't give him children. Set him free. The bone marrow transplant had rendered it impossible for me to have any more children. And he was younger when I married him, and then he decided he did want children. So I set the divorce papers in progress as I began the treatment for the hep C. So that was very sad, but...
You also describe in your statement your infection and the associated symptoms impacting upon your career and your educational aspirations. Can you tell us a little about that?
Yes. When I got out of the bone marrow transplant, there had been no support for me. I was pregnant with cancer, and I'd asked for support, and there was no support at all. So as soon as I recovered from the bone marrow transplant, I set up a cancer support group in my nearest town, which I ran for 10 years. So in the course of doing that, I trained to be a counsellor. And, sorry, can I just... Yes, so I trained to be a counsellor, and the placement on my course was working with people with alcohol dependency. And so I continued doing that after my training and after I closed the cancer support group, because everybody in it was dying and it was just too painful. And the closest friend I was running it with was also going to die from her cancer. So we closed it before she died. But then I carried on with the counselling. I was working for an organisation called ALCAS, and then for AdAction in the hospital in Bideford, and I just loved it, absolutely loved it. But I'd come away, I'd see 2 or 3 clients in the morning, and I'd come away so drained that I couldn't function for the rest of the day. And then within a certain period of time, I realised I just wasn't up to it anymore.
You say in your statement, it was about 2003, you had to stop all of your counselling work because of the strain on your health. You did some occasional work after that, I think, in a pottery studio, but then you had to give that up in 2008.
And I did a holiday let cleaning for 6 months or a year or something. I used to go and do 3 hours cleaning. I couldn't move for the rest of the day. And that caused friction in our marriage because he was free on a Saturday and I would do that all Saturday morning. I used to take my son with me to do it. And he'd get upset because I couldn't move. I literally could not move for the rest of the day.
And you've also talked more generally in your statement about making job applications and repeated rejections, which you attribute to your health.
I applied for care work and never had any word back. And of course I'd be upfront. I would tell them about the Hep C. I'd never hear back.
And you mentioned earlier the art course that you were doing, Art College. What happened in relation to that?
I'd always been torn all my life between going to art college. I had an unconditional place at art college when I was 18 in Ipswich Art School, but it meant living at home with my parents for another year, and I needed to spread my wings a bit, so I went to university and did a psychology degree. So all my life there's been 2 branches of the psychology and the art. So at that point I decided to go back to art school and do my art degree. And I was just so tired. It was up 2 flights of stairs. It was a 25-mile drive up 2 flights of stairs. And by the time I'd spent a day, I loved printing. I was doing prints called Grin and Bear It or Put a Brave Face on It, all to do with my illness and how I present to the world and what's going on inside, how we wear a mask. And by the time I'd done a day in the print room, I'd come home and I was good for nothing for the family. I couldn't move, and eventually I had to give it up.
Now, you've mentioned the cancer returning. I think that was about 1998. And you had to have various treatments, radiotherapy, surgery in relation to that. But there was an impact also, I understand, on your hepatitis C at that time. Can you tell us a little about that?
It was about the same time, probably, that the Hep C started to kick in, but it was so hard to separate it all. I was doing my counselling diploma then because they gave me a room in the hospital because it was so far for the radiotherapy. I used to stay in the hospital for the weekdays. Somebody else looked after the children, and I wrote my essays in there. And it was about the same time that the Hep C started to really sap my energy. But it's very hard to separate.
You tried various treatments in relation to the hepatitis C. You've mentioned interferon. Was it a 48-week treatment process?
I did. I lasted for, I think I did 12 weeks or 14 weeks. They pulled me off because my blood counts had dropped so low. So I went for acupuncture. I took traditional Chinese medicine, milk thistle, all kinds of herbs and supplements, researched it. I was buying in from America packages of herbs, but I couldn't afford it because I was on benefits. I just couldn't afford it. And I couldn't get the support from Skipton.
We'll come on to the Skipton in a moment, but just in terms of the side effects from the interferon treatment that you attempted and had to give up, what kind of side effects did you experience?
From the interferon, again, it's hard to separate from all the chemo damage, but the ribavirin knocked my blood counts really, really low. the interferon quite possibly had lasting cognitive effects, might have been connected to the fibromyalgia. It's difficult to know.
You describe it in your statement in these terms. I would describe the effects of being on these drugs as like falling into a deep and terrifying abyss of pain and despair. And you told your doctor, over my dead body, would you ever take interferon again?
No, that was when
Not an
I was
accurate
on the
summary.
treatment and my partner left me to go paragliding. And yes, I've never been, I'm not a depressive person. I've never known depression. But it was like a crawling pit. I was seeing demons. I was hallucinating. I was doing artwork at night, drawing monsters, and horrible treatment.
So it was about 10 years before you were able to attempt treatment again for the hepatitis C,
Yes.
and you started a trial of Epclusa, but discovered, I think, that you'd been to start within the placebo group.
Yes, I was searching for trials. I tried for a trial, an AbbVie trial in London. My consultant knew I was searching, and he was actually running a trial. And so he said, I think this would be good for you. And I said, no, I want these drugs. He said, these are better. And so I was ringing the research nurse every single week so she wouldn't forget me, and made sure I got on it. But yeah, I got the placebo run the first time around.
But second time round, you were on
Well,
the
I knew
proper-
if I was the 1 in 6 that got placebo, I would get the real one. But the problem was that I wanted it done by the January, because my daughter here was getting married in Greece in the August, and because I got the placebo and then 3 months treatment, 3 months off, then I had to re-screen to be accepted again. It meant that I didn't finish treatment till about 2 or 3 weeks before the wedding, but I just got it in.
And with the second treatment course on Epclusa, how did you cope with that?
It was okay. I had quite a lot of fatigue with it. I don't know if that was just the body working hard to expel the hep C. And I started to get tinnitus 6 weeks in, and I have mild to moderate hearing loss now, and I still have the tinnitus. I can't say it's definitely connected, but I think so.
Well, I think you say in your statement other members of the trial also experienced just similar hearing problems in consequence of the treatment.
I have come across other people because I work on a very big international hep C support group. I'm an admin. It's got 6,000 members, so I see a lot of people on all the different medications, and other people on one of the drugs, Sovaldi, do report tinnitus.
Now, this treatment was finally successful in clearing the hepatitis C virus.
Yes, it's magic.
And I think that was February 2016. You say you were declared cured and discharged. But the way you put it in your statement, I wanted to ask you about, Kaz. You say being discharged over the phone was a big shock. After 24 years of constant appointments and care, you felt adrift to start with.
I did, because I was discharged by my research nurse in a phone call, and she rang me up and said, you're cured, that's it, and you don't need to come to the clinic anymore. And my hepatologist, Matthew Cramp, and my haematologist, Mike Hammond, had been working together all those years in my care, and I'd felt very held and very safe. Brilliant doctors, both of them. I can't thank them enough for all their care. But yeah, I suddenly felt because I didn't have fibrosis, I wasn't eligible to have the follow-up care.
You have asked, I think, from time to time since then, for there to be repeat FibroScans so that you can either find out if there's any liver damage or be reassured if there's not.
I asked a few months ago if I
you
could
were told
have...
no.
I went to my GP to ask, and he said, well, he was brilliant. He said, where would you like me to ask? He didn't know anything about hep C, didn't know anything about the scans, but he was willing to learn. And I said, well, I'd like to go back to the liver unit. So he sent a letter there, but I got the reply back with, you don't need one because you didn't have fibrosis.
Counselling. During all the many years of treatment that you had, did you ever get offered counselling?
No. I did for the cancer, but not for the hep C.
Do you think that would have been useful?
Possibly in retrospect. Possibly. I mean, I had peer counselling as I was doing my counselling diploma, but I don't think I particularly brought the hep C to it. I think it might have been useful.
Now, you've mentioned in passing the Skipton Fund, and that's what I wanted to ask you about now. You and the consultants who you've mentioned have had little doubt over the years that your hepatitis C was as a result of the transfusions and the treatment you received. What happened when in 2004, when you were a single parent, you had your 3 children dependent upon you, you applied to the Skipton Fund for help? What was the response?
No, you don't fit our criteria. Our cut-off date is September 1991.
I'm going to ask for some documents to be put on screen, Kaz, so that we can have a look at some of the exchanges you had with the Skipton Fund. If you just give me a moment. So the first document, Paul, is 622007, please. And could you highlight the handwritten passage on the form, please? Have you got that, Kaz? So this is an extract from the application form, and the handwriting is that of your doctor, your consultant. This lady received a number of blood transfusions from 1992 to 1993 while undergoing chemotherapy for Hodgkin's disease. Whilst infection occurred outside the timings in this form, no other risk factors are present, and the hospital treatment and transfusions are thought to be the cause. So that was your consultant's supporting confirmation in your application?
Yes.
And then if we could have document 8, please, Paul. So 622008. This is the letter you received from the Skipton Fund, 14th of December 2004, is it?
Yes.
With regret, I must advise you that your doctor has advised us that the date of infection was in February 1992, and accordingly outside the scheme guidelines. In the circumstances, I must advise you your claim to the fund has been declined. What was your reaction and response on receiving that?
To fight them.
I think if we go to document 9, 622009, Paul. We can see a letter from the Skipton to Dr. Hammond, who's one of your consultants.
He was the haematologist who took me through the bone marrow transplant.
And we can see from the first paragraph of this letter, dated the 18th of February 2005, that Dr. Hammond's obviously written in support of your application to the fund. And the response is, as I'm sure you will appreciate, when the Department of Health established the fund last year, expert specialist advice was taken regarding the mechanical aspects of the fund, and this included the screening of blood products for hepatitis C. In this respect, the information provided to the fund by the Blood Transfusion Service was that all blood products after the 5th of September 1991 used within the NHS would have been screened for hepatitis C. Sorry, is that still on the screen? Because mine's gone down. Thank you. So that was, again, the rebuttal from the Skipton Fund to Dr. Hammond. You, I think, appealed that. It's 622010, please, Paul. I hope you'll see a letter from you, dated the 23rd of March 2005. Do you have that? Should be coming up now. Well, so this was your appeal to the Skipton Fund. You've referred in the first paragraph to the letters of support from your specialist consultants, and you've said this in the last part of the first paragraph. All 3 of these consultants are in full support of this application and share the professional opinion that my hepatitis C was indeed acquired from blood products received by me during treatment in 1992 for cancer. And then you've talked about living each day with the malaise of being hepatitis C positive, the struggle to get through each day, single parent of 3 children, unable to work. And then you say this in the final paragraph: to impose an arbitrary cut-off date which excludes legitimate cases such as my own seems merciless and mechanistic when dealing with people who are in real trouble with this insidious disease. What was the outcome of that request for an appeal or review?
Another rejection.
And then if we have document 11, please, 622011, Paul. So we're 2 years further on now, 2007, and you're still trying to ask the Skipton Fund, is this right, if they will reconsider their decision?
At this point, I was desperate. There was no treatment for me, and I was absolutely desperate to be able to buy these herbs in from America to try and cure the hep C myself, because there was no treatment in the pipeline. And the only way I'd be able to do it would be if I was granted the £20,000.
And if we can look and see, you've set out here some of the supporting more recent observations from your consultants in this letter. You've set out an extract from what Dr. Hammond said, and then you've said this: as my bloods were given so soon after the beginning of screening, is it not likely that unscreened blood could still have been in the system, or that infected individuals were still giving blood as they'd not yet tested positive, i.e. they were not yet making antibodies? And then you've referred to Dr. Cramp in his letter: well known that there are rare cases in which the hep C virus RNA can be present, sufficient to transmit infection in the absence of an antibody result. And then Dr. Hammond again: specifically, it seems quite likely that the transfusion was the source of your hepatitis C. It may be that one of the donors was indeed the source but hadn't yet made antibodies to prove positive on the screening test. And then Dr. Cramp also pointing out the possibility that you might have been given blood products that had been frozen but donated prior to September 1991. Now, you've made various arguments in that letter. Did you ever receive from the Skipton Fund anything which addressed in any kind of detail the specific points you were making there?
No.
And if we go on to document 12, 622012, please, Paul. We see the letter you received later that month, March 2007. If we just look down the bottom of the first page, please, Paul. It just keeps going down. The bottom of the page, your appeal, sorry, I'm not sure whether I'm seeing it on the screen in the same way. Your appeal was considered by the panel at its meeting on the 23rd of March. Have you got that? And then the panel reviewed the entire file of papers. Can you see that, Kaz?
Yes.
Yeah. So this was the rejection of your appeal. We noted that the treatment which you believe gave rise to your infection with hepatitis C took place after the 1st of September 1991. Unfortunately, this takes your application outside the terms of the Skipton Fund, and we've no discretion to change the time limits. We regret we must refuse your appeal. Now, did you have any further dealings directly with the Skipton Fund after that refusal of your application?
No, I don't think so.
Subsequently, you had, I think, some interactions with the blood transfusion service.
Yes, I had numerous letters with, I think, Dr. Patricia Hewitt, who is the head of the transfusion services, I think.
And you were told that the donors who had given the blood that you had received had been traced, and that none were infected with hepatitis C.
Well, for a long time, one was missing, and eventually, when that one turned up and appeared to be negative as well, she said that effectively eliminates the transfusions as a source of your infection. But she did say to me in a phone call, but, basically she suggested that she believed that I had got infected through the treatment, but it would be like searching for a needle in a haystack. They were her words.
Now, you've, I think, subsequent to that, done a little investigation of your own in relation to the particular batch numbers that were examined, as far as you're aware. And could we have document 622004 on screen? And if you could just highlight the bottom part of that page, please, Paul, where it's got various numbers and handwritten entries. Thank you, if you stop there. So we've got, well, can you talk me through, Kaz, please, what we have here?
What we have here is the original letter that was written by my haematologist in 1997 asking for the batch numbers to be checked. And I obtained copies of the actual blood reports, which I have copies of, and you have copies of, and I cross-referred, and the batch numbers have not been transcribed exactly right. So in the first one, all the ones with an asterisk are slightly out. You can see the first one reads 68906TT9, and the actual number is 6890670T9.
And if we go on to the next page, please, Paul.
And the first four, which were all given in one transfusion on the 5th of May 93, the zeros have all been transcribed as twos.
So, having ascertained that for yourself, thanks, that can go down.
A further error as well, is there, in the first one, because it's 8-3.
Yes, you're
yes.
right. Yes, I forgot that one, yes.
Having found those discrepancies out for yourself, did you take any steps in relation to them?
Yes, this was about 2 years ago. This is after the inquiry started happening. I thought, well, I might as well try once more, gather my energy and try once more. And I got more copies of bits of my blood records, and I rang the blood service and asked them if they could, I said I'd found these discrepancies, could they please check the numbers? And I was told I didn't have the authority to ask for that, and I would have to go back to the original haematologist who asked for these checks back in 1997, who I know is retired. So I went begging to my brilliant haematologist, Professor Cramp, who is such a busy man, and I hate bothering him. So I went begging to him with a letter saying, can you, I transcribed, sent all the copies of the original letter and the blood reports, and another copy with my red number changes on it. And that was November, I think, 2017. He sent that off internally to a haematologist at Derriford, because he's a hepatologist, to ask his advice, and said he'd get back to me. And I haven't heard any more, and I just haven't got the heart to bother him, because he's such a busy man and he's doing such brilliant work.
Now, in your statement, as well as describing this possible mismatch between the batch numbers listed and the units that were subsequently tested, you've identified in your witness statement other possibilities that may explain why it is that you were infected, as you and your consultants believe, in consequence of the blood transfusions. And you've said this, the possibility that a donor with hepatitis C could have evaded the screening process. The antibody tests used at the relevant time are renowned to be fallible. And in addition, early on in any viral infection, an individual can be infective yet have negative tests for the virus. Alternatively, possible for someone to have been infected at the time they gave blood, but not at the point of the next donation. And those are the very points that Dr. Hammond and Dr. Cramp were effectively making on your behalf in your correspondence with the Skipton.
Yeah, I'm not any kind of a scientist. I took my words from what they said in their letters. And actually, Patricia Hewitt had also said the same thing.
Having had your application rejected those years ago by the Skipton Fund, are you able to claim anything from the replacement scheme?
Not a halfpenny,
EIBSS?
no. I've tried twice. The first time I was told no, then I tried again, and she spoke to her manager and she rang me back and she said, well, I could send you the forms, she said, but I really don't want to put you through filling them in for no reason. And then a very dear friend here, who's come to support me, pushed me again to do it again. So I have actually got the forms at home, but I can't see the point of bothering any doctor to fill them in because they've still got the same dates on them.
And you've said in your statement that the rejection of the application for any assistance from the Skipton Fund has meant you've had to rely upon welfare benefits and you've had to endure the humiliation of work capability assessments to get those benefits. Could you tell us a little about that process?
The work capability assessments, about 5 or 6 years ago, I think I had the first one, and there were 5 false alarms before I finally got one. The first time I went, it's a 50-mile round trip, I went with a friend. I was so nervous, and we waited for about half an hour, and then they told us that the computers were down and sent us away. And there were 5 more attempts before I finally got one, by which time I'd asked for it to be recorded. Then I was found fit for work. Then I had to appeal that. Then, after a mandatory reconsideration, they put me back in the support group, where they should have put me in the first place. And then, as they sent me the letter that I was back in the support group, so there was another bundle of forms to start the whole process again, because apparently they'd lost my files. So they wanted me to start all over again. It's so, so stressful. And I have one of these every 3 years. The last one, I took a friend with me. It'll be nearly 3 years. It's coming up soon. And we waited about 40 minutes, I think. And we went in, and it was completely different, actually. It was a nurse, and she said, I'm so, so sorry that you've had to wait so long. She said, I wanted to read all your notes and your letters. I'd sent 5 or 6 supporting letters from my family, and I'd written a document describing my life and my history, potted history. She said, I wanted to read everything. She said, I can see that life is really, really difficult for you. At which point I just burst into tears because I'd been heard. And she was brilliant. She, of course, put me in the support group, and she finished the interview early. She was a gem amongst many who are not as compassionate.
Now, your statement raises a concern based both on your own experiences, but also your wider experiences as part of a hepatitis C advocacy group, about the continuing lack of knowledge in the medical profession about hepatitis C, its effects and its symptoms. What experiences have you had with doctors that have led you to form that view?
I had a doctor when my son was about 7 years old. He was feeling quite unwell and quite tired all of the time. And so I took him into my GP, who'd known me since the cancer, known me all the way through, and said, do you think you could maybe test him for hep C? He looked at me and he said, what makes you think he might have hep C? He was my family doctor. The same doctor, many years later, with a work capability test, I asked him to write a letter for me, to help me with the work capability test. He looked at me and he said, well, I think you could work. I repeatedly went to doctors and said, I'm so, so tired. Please, can you run some tests? I don't know what to do. Oh, the hep C won't be making you tired. The people who heard was the hepatologist. He always backed me and heard because he understood hep C. But the GPs, they just have no understanding. The one I had when I was going through the Epclusa trial, he was kind of interested, but not engaged. He'd listened to me rattling on a bit about being on the trial, but he wasn't engaged. And then the one I've got now, even though he's a much younger one, so he will have trained more recently, he's very eager to learn, but he didn't know what a FibroScan was, and that's the one that I went to see to ask for a FibroScan, had to explain what it was. So they're still not being taught in medical school what to look for, and they're not testing people, and that's my big mission, is to get more education and awareness and get people tested. You know, now that we know that there's a finger prick test called Oraquick that's available for £12.
I think you produced some documentation in relation to that. Paul, could we just put that on the screen whilst Kaz is talking about it? It's the NICE document.
So it costs £12. It could be provided to every single patient. I want every single person in the UK tested and treated. We have a 12-week cure now. If every person's tested, then we'll find the missing thousands and we can eliminate Hep C. They're talking about eliminating Hep C here by 2025. They're not going to do that unless they test everybody and find everybody. They can do it. It's cheap.
Kaz, those are the questions I had for you. Is there anything else you wanted to say?
Thank you. That was one of the things, so I've covered that now. My big thing is I want more advocacy, more education and awareness to reduce the stigma and the fear. I know people who got Hep C through hospital treatments who still haven't told their family. The stigma needs to be resolved, and that will only come with more education. More education for the prevention of transmission so that Hep C doesn't slip through the net like it did for me somehow, somewhere, not through deliberate negligence maybe, but somehow it got through. So I want more awareness, and I want, the third thing was everybody, every single person tested and then treated. I was speaking to Rachel this morning from the Hep C Trust, and she said they've had a huge increase in calls from people infected post-1991. So I want more awareness around the cut-off date of September 91, because it's still going on. It's still slipping through. I want inclusion for all affected. It's taken me a couple of days here to realise why I've been feeling a little bit like outside of the group because of my dates, and a little bit, well, I don't know if I should really be here. And it's just clicked. It's because Skipton told me I was not worthy. They made me feel unworthy. I wasn't worth any kind of compensation, any kind of financial support. And so I'm very angry about that, and I want those criteria changed. So I want inclusion for everybody affected. And that's it, really. And I want to say thank you to my children for being here and my wonderful friends who've come to support me.
Thank you.
Thank you.
Kaz, do you want to just stay there?
I don't worry, I have nothing to ask, but I do have my thanks to you for coming, which plainly everyone here appreciates. Thank you very much, Kaz. Ms. Richards, shall we continue, or shall we take a break?
Well, so I think it might be slightly easier if we were to take our break now early. Mr. Nicholls is the next witness. Ms. Fraser-Butlin will be asking him questions, so we need to rearrange things and also see if the monitor can be repaired. So perhaps we take the break now, and then we'll hear from Mr. Nicholls after that.
Well, we'll take a break to make sure that the coffee arrives in time. Shall we take a break until 11:30?
Thank you.
Miss Fraser-Butlin, the next witness wishes to be called Stephen.
Steve.
Steve, thank you.
Please state your full name. Stephen John Nicholls. And repeat after me. I do solemnly, sincerely,
I do solemnly and sincerely
and truly declare and affirm
and truly declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the
and nothing
truth.
but the truth.
Steve, you were diagnosed with haemophilia B when you were about 1 year old.
That's correct, yes.
And initially, when you were diagnosed, you didn't have many difficulties with it in the very early days.
No, I think it was a classic diagnosis of haemophiliac. Before one, you were bruising a lot under your arms, and the parents became alarmed. You were going to the GPs and to the hospitals, and again, there's the classic parents coming under the radar of, is this child abuse, is this baby battering, before the diagnosis, because it's obviously it's very unusual for a child to be bleeding and have things, but about 1 year old is when the formal diagnosis of haemophilia came through, yeah.
But from about the age of 4, you had more regular and severe bleeds.
Yeah, I think as the haemophilia starts growing and growing fast is when the joints are developing, and that's where the bleeds really become fast and furious, yeah.
You were treated with cryoprecipitate until you were about 6.
Yes,
And then changed over to factor 9 concentrate.
yes.
As far as you're aware, were there any discussions with your parents of any risks involved in that change?
Absolutely none at all.
And about that time, you were also put onto home treatment.
I was, yes.
Now, can you describe for us what the impact of haemophilia B was having on you by the time you were about age 6 or 7?
Personally, my memories of pre-5 would just be pain and hospitals. That's all I can remember. And dread of going to the hospitals. Upsetting my parents. At 5, school age, trying to attend a mainstream school, being sent to a mainstream school, missing more than what I was able to attend because I was bleeding. Pain, and constant bleeding, really constant bleeding.
You mentioned missing a lot of schooling. At about 6 or 7, your parents applied for you to go to Challis school.
That's right, yeah. They'd heard through a personal friend who was given a teaching placement there of this school in Alton, Hampshire, that was recruiting a lot of haemophiliacs, and there they were getting a really good education, and it was geared up when the medical treatment was freely available on site.
And when did you start attending?
I started attending when I was about 8 years old.
So about September 1976.
Yes.
And you still believe that Challis was the best place for you to go?
I do. I understand where the decision was made from my parents, because obviously they wanted to give me a good education. They wanted me to have the best medical treatment. And at that time, you would report to my local hospital, which in that case I was living in Portsmouth, which was St Mary's, and you were literally fighting for treatment because the treatment wasn't readily available. You wouldn't see the same doctor more than once. It'd usually be a houseman, and the general consensus was go home, bring it back in the morning to see if it's any better. Obviously, you quickly learn it'll never get better, so the bleeds got worse because the treatment just wasn't as freely available. But at Challis, it was made clear that if you had a bleed, you would be treated within hours.
And in terms of your schooling and being able to attend school?
Obviously, yeah. And Challis, yeah, it's educational. I'll tell you a little bit about the geographics of Challis. There was 3 establishments of Challis within about 3.5 miles of each other. There was what was known as Lord Mayor Trelaw College, which was a very grand old style school which was purely boys from the age of around 11 upwards. There was Florence Trelaw School, which was just down the road, which was predominantly girls, and haemophiliacs, boys and other boys that are under 10 were put in that unit for the first 2 years until they were able to move up. And there was Trelaw Hospital, which again was about a mile down the road, where all the treatment was administered in the early years.
And when you first went to Trelaw's, you were receiving both cryoprecipitate and freeze-dried factor 9.
I have memories of having cryoprecipitate at Trelaw's, but very quickly the push for everybody to be changed onto factor concentrate became apparent, and I was one of the first ones to be put permanently across. Yeah.
And when you were put permanently across to the factor concentrate, again, was there any discussion with either you or your parents about the risks of that treatment?
Definitely not to my parents. To myself and the other boys, it was being sold to us this is a miracle to you guys. To have cryoprecipitate would mean you would be lucky to get out of the treatment that day. It would take 2 or 3 hours to administer. You'd be under a drip with your arm out, 2 to 3 hours, and then they'd like you to rest for 2 hours before you went back to normal life. Sometimes it was long, depending on the size of the dose. This was coming in a 60ml syringe, which could be administered within a quarter of an hour, 20 minutes, and you could get up and walk away. And of course, this was in little bottles, which you could take home with you, administer yourself at home. So cryoprecipitate couldn't be administered at home. You had to report to hospital.
Now, when you were about 11, so about 1978, you went on to prophylactic treatment.
I did.
Can you describe how that was carried out at Trelaw's?
Prophylactic treatment is basically they would give you treatment every other day, usually, maybe 2 to 3 times a week on a routine basis, which would prevent bleeding virtually, because obviously your factor levels were high, so you didn't bleed. There was a really, really big push in those years to get as many haemophiliacs as they could onto prophylactic treatment. Again, there was no risk assessment done to me. They didn't say this stuff contains a risk. Obviously, the more you have, the greater the risk. That wasn't explained at all. It was just sold to you purely. This will give you a more normal life. You'll have more free time. You'll be fitter. So take it.
You've described the treatment room at Trelaw's.
Yep.
Could you describe that for us in your own words?
As I say, I'll go back the very early days. All the treatment was administered at Trelaw Hospital, and that would mean that every morning there'll be transit vans pull up outside Trelaw School or College. 12 haemophiliacs would get in, because that's how many they seated, and they'd be ferried to the hospital where the treatment was administered. In those days, it was mainly cryoprecipitate. You'd be down there 3 hours, and then they would ferry you back to the school, and these vans were running 3 or 4 times a day. After I'd been there about 2 years, the actual haemophilia centre moved to the school, so it was administered actually on site.
And what was the room like on site?
The room on site was contained, I would say, it contained a sink, 8 to 10 tables, 8 to 10 chairs, and a doorway which went through to where the storage area where the factors were being stored.
And when you went in for treatment, what did you find?
In the early days,
in the treatment room on site.
in the treatment room on site, well, physically, what was in there?
Well,
when I was having treatment.
You described that when you arrived, pre-mixed doses would already be out on the tables.
Especially, I mean, say at Challis there was, at the heyday when I was there was probably up to 50 haemophiliacs in attendance, and you think if they were pushing for these, most people were having three doses a week, so every morning there would be 20, 25 haemophiliacs queuing up for their treatment. The treatment room itself contained 8 tables. When you went in there, it was very regimented at Challis. You were known by your surname. You were given a number, a laundry number, and your surname. There was no Christian names. And again, these are all pseudonym names I'd be using. It'd be Joe Smith and Bloggs written on a white Luxon sheet on the table with pre-mixed doses. So there'd be syringes with just a clear substance in it. Some may vary with people's names on around the room. So you'd report there, look for your name. If your name wasn't in there, you may wait till your name was called.
And you've described that in the early days, if a boy hadn't turned up for treatment and there wasn't a syringe ready with your name on it, you could simply be given someone else's dose.
Exactly. If it's like Thursdays, they knew it was, again, pseudonyms, Smith, Bloggs and Harry's day. If you turned up and your name wasn't in there, and they said, well, where's Harry today? Well, didn't you know he's got an exam? I said, well, you might as well have, because he was coming back later. So there's absolutely no way you knew what was in that particular syringe, what product was in that syringe. All you know is it had been pre-mixed and it had your name on it.
You describe that it was very much like a cattle market for a particular period of about 4 years.
It was. It remained that way for around 4 years, yeah.
In about 1982, when you were about 15, the push for prophylactic treatment, you say, seemed to slow down.
It did, yeah. Obviously, boys being boys there, we wanted to play football, be out riding bikes. The last thing you wanted was to keep being called up for prophylaxis treatment all the time. And there was, we didn't like it, but if you could stand it, they would push for it. But as the boys got older, obviously refusal started to happen. No, I'm not doing that. But it wasn't because of any of the risk of infection, because it wasn't known then. It was just purely because your veins, your physical body couldn't take it.
You also say that the way in which treatment was organised from when you were about 15 changed completely.
Absolutely, yeah.
Can you describe what changed?
There was locks put on doors. You weren't allowed in the treatment room on your own. A mixer was installed in the treatment room. The bottles were in the treatment room. The treatment product was mixed in front of you in the mixer machine. It was pulled up in front of you. Records were kept. It was clear that every batch number was being taken off the product, and you noticed the change there. Yeah. So.
Was the reason for this change ever explained to you?
No.
In about 1983, you recall media reports circulating about a link between haemophiliacs and AIDS.
Yep.
In your statement, you describe that around this time, some of your friends at the school started showing symptoms of illness.
Symptoms of illness, yeah.
Can you describe what was happening?
There was always, this will sound very flippant to you, but there was people were ill at Challis. We accepted that there were ill people there. There'll be cases of hepatitis there, or many, where one of the haemophiliacs would go yellow. He would get no special treatment at all. He would attend school as normal. He would play football as normal. In fact, he would be teased about being yellow. That's just the way it was.
I think you said that there was a name you used to call him.
Yeah, he just used to be called Banana or something like that. And a month later, he'd be better, and it'd be someone else. It was just so normal. It happened on a monthly basis.
But 1983.
Yeah.
You've indicated that it was a little bit different. In
1983, there had been rumours circulating about AIDS, and you've said that
there was
around that
rumours
time-
circulating about AIDS, and the link was being established between AIDS and haemophilia.
And you said that around this time, some of my friends at school started showing symptoms of illness that was nothing to do with haemophilia
Yeah.
bleeding. It was an incredibly scary time
It
for
was.
us.
Yeah. People were becoming flu-like symptoms. People were going home for the half-term break, and they wouldn't be returning. There was a lot of people, glandular fever, throat infections becoming a lot more prominent, and everybody was worried because the link, the press story was just breaking that there was a link between haemophilia and HIV. Yeah.
You've described a pact that you and 4 of your closest friends made. Do you feel able to tell us about that pact?
That was probably a year later. It was either in my very last year or the first year that I'd left, when the first haemophiliacs were starting to die. And everybody was really scared. And there's 4 or 5 of us in a room, and we realised that this is serious and this is killing us, or killing haemophiliacs. And we said, this is going to happen to us. We could see it, and they said, right, we've stuck together right through our childhood. I said, if it happens and it kicks off, we're going to rely on the person still alive to pursue it and find out why and what went wrong. And I'm the only one left. That's fine. That's tough. I think about that every day. And it's tough.
What was the school's response to the rumours and the increasing illness of the students?
Again, Challis, we've just established that the school and the haemophilia centre, they were on the same site. There was just big double doors between them. This side was the school, the education. That side was the haemophilia centre. They didn't hide it, but the way it broke at Challis was the newspapers. No one had mentioned the word AIDS or anything. It was all over the newspapers. Obviously, the haemophiliacs wanted answers and started to ask questions. And I think, first of all, they said, don't worry, just carry on as normal. Just carry on. And we sort of accepted that. So Challis we were exposed to mortality at a very young age at Challis. Obviously, there were some very sick people there, and I was there for 6-7 years. I saw a handful of people die there. I'll give you one example where we were playing football. One of the lads just dropped dead on the floor. Obviously, we were 13, 14-year-old lads. So one of us jumped on the bike, quickly ran round on the road round to the haemophilia centre where the doctor was on call. He came running down with a bag. Got there too late. He'd gone.
So that was somebody before the.
This was before.
But in terms of how the school responded and talked to you about what was going on, was there any discussion from the school about what was
Not when I was
there,
no, not when I was there.
Now I want to move on to look at some of your records and your own infection. You've obtained your records from Challis. How did you come to receive them?
I've received patchy records. They're not complete by any means. There are large sections missing. 3 to 4 attempts were applied for. Challis is no longer. It's now all moved to Basingstoke. Initially on repress, they said no, they've all gone. We haven't got them anymore. I kept trying. Received dribs and drabs through, and then one day I went to Challis, over to Basingstoke to the thing, and they said, Stephen, I said, you were after records, so there was a new haemophilia doctor had arrived. He said, we just unearthed boxes of records in a cupboard of the Challis days. Well, would you like them? Of course, I said, very much, I would, yes. And they weren't complete, but there was 3 or 4 guys who got a reasonable set of notes there found in the cupboard. Yeah.
Paul, can we have document 1432006, please? Thank you. So this, we should be able to highlight. Thank you. The date here is January 1977. You can see that on the left-hand side of the screen. And you've been identified in the bold letters as a hepatitis risk.
Yes.
Were you told about this at the time?
No.
And if we can go to document 1432005. If you look down the middle column, you first tested positive for hepatitis antibodies in January 1979. Yeah.
Yeah.
Were you told about this at the time?
No.
Were you even aware that you were being tested?
No.
And please can we have 1432007? Could we highlight that second paragraph, please, Paul? Thank you. It says your SGOT was slightly raised and had been since January 1979. What's your understanding of what that means?
I have no idea.
Oh, okay.
Honestly, I don't. I'd imagine it's something to do with the liver function test.
You've said in your statement that you understand that raised SGOT is an indication of damage to the liver.
Yeah, liver function tests. Yeah, but I don't know what
That's
SGOT actually stands for.
That's okay. Were you told about this at the time?
No.
Now, you remember being told to avoid alcohol
Yes.
while you were at Challis, but you say you were certainly never advised that you had or were at risk of hepatitis.
No, the first time they ever discussed liver problems with me was a highly respected haemophilia nurse, and it had been mentioned at this stage that to avoid alcohol because of liver problems, and they said your liver is under enough strain as it is coping with the amount of factor you're having, so don't give it any extra pressure by drinking alcohol.
And you weren't told about your hepatitis infection until 1991, which we'll come on to in a moment. Now, you're aware that your blood was being tested regularly while you were at Challis.
Absolutely.
Why do you think that was?
It was the norm to have blood taken, I would say, on a fortnightly basis, if not a weekly basis. Sometimes every other dose you were having, it would be, oh, Stephen, we just need some blood from you. And you would literally stick your arm out. They would pull 60 mils back in a syringe, start squirting it into bottles, connect your factor up, and you had your factor and you'd go. You didn't question it. It was normal. To not just me. So I'm speaking for the whole of the Challis boys there. It was normal for people to be giving blood on a weekly to fortnightly basis, large quantities, not test tubes, tens of test tubes.
You've said, I'm convinced that many of the pupils at Challis were monitored very carefully and that they did all the tests that they could, possibly for commercial interest and or financial gain.
I do. I think Challis had access to virgin haemophiliacs, so to speak. Pups is another word. They had boys there from 8 years old who had obviously never been exposed to any drugs, sex, alcohol, any other ways that any of these infections could be contracted. And they were monitoring us. They were taking blood and looking at how things were developing. You know, how fast is this progressing? Who is getting what is happening here? And we didn't even know anything was happening. It was just the norm for blood to be taken in large quantities to all the boys there.
What impact has that had on your willingness to attend medical appointments once you'd left Challis?
I don't have much faith in the medical system. I find trust very hard because sometimes they're not telling you exactly as it is. There's an ulterior motive for what they want you to do. And that is the beauty of the internet now. You can research things, and the good thing about Challis was to say 89 boys went there, and I'm one of the 16 still left. But we still talk. We can confer with each other, even at the other end of the country, what is happening to you, what is happening. And he's been told something totally different to me, and you can question it. So I'm very fortunate to have those companions, those people who are going through exactly the same things to you to confer with. So we're a tough bunch to be, yeah, because we can talk to each other.
In those early years after you left Challis, what was the emotional impact on you of what was happening to your friends?
Oh, it was astounding. So the bonds that were built at Challis, I say, you know, we ate together, we learnt together, we were treated together. So the bonds that were built became like brothers. They weren't just like schoolmates, you know. And close friendships, close bonds were built there. And to see your friends dying one by one, and it's always in the back of your mind, they're the grace go I could be next. And that was, obviously we were feeling it, but some people handle it in different ways. My way was, I just blotted it out, just focused forward, and told no one. And that nobody included, obviously my parents knew I was a haemophiliac, but they didn't know all the problems that was going on with it. I sheltered them from it.
You were first told that you had hepatitis C in about 1991.
Yeah.
How were you told?
I was told face to face by the doctor. Flippantly, I would say is a good word. It was in a routine examination. I was doing, by the way, you've tested positive for this. I didn't really know what it meant. Obviously, I was fully aware of the HIV because that was in full flow by this time. I thought, what are you saying? He said, you know, not too much to worry about, but life expectancy could be affected here, but my advice to you is just carry on as normal, carry on as normal. And that's what I did.
You said that the doctor was extremely guarded and simply told you to be careful.
Yeah.
Did he tell you anything about the possible routes of transmitting the infection?
No, not then.
And how did you feel when you were given that diagnosis?
Obviously, you know, the death of haemophiliacs when this was happening was really, really massive scale. You know, it was one a month, and I'd attended many funerals. And I suppose when you attend so many and you see 30, 40 of your friends die, it's always in the back of the mind that the grace of God go up. You do become slightly hardened to it. You do. And I thought, this could be it, this one. And yeah, I was shattered. It took a while to sink in and for me to decide how I'm going to cope with this and what am I going to do. And I decided to just crack on with what was left. Don't look back. I became very anti-Challis for a while because I thought it's not worth going back there. There's none of us left, but I pulled myself together and thought, just live for the day, just keep going, and that's what I did.
And one thing you did after you were told about your hepatitis C is you became worried about your own financial position. So you found a job at the Parks Department of the local council.
Exactly. I mean, again, it was well aware at this stage that haemophiliacs couldn't get life insurance and therefore couldn't get a mortgage. And I thought, well, how am I going to get around this? And I thought, well, think logically, let's pursue going for jobs at accommodation. And that's what I did. Again, I didn't declare it at that time. I was a reasonably well man. I was and told nobody. Yeah, and got the job.
So you particularly went for that job because of the tied accommodation that came with it?
That's what attracted me to it, yeah.
After about 2 years in that job, you left the role.
Yeah.
Can you tell us what happened?
Somebody spotted a disabled sticker in my car and obviously started to dig. And the first thing I knew is you've got an appointment with Human Resources, I think. And she was called in and there was a lady sitting there I'd never met before. And I started asking questions. And I was totally flabbergasted by the questions she was asking, but somehow she got the information. She knew I was a haemophiliac, and she didn't ask me directly, but I could see exactly where she was coming from, and obviously I couldn't deny it. So I listened to what she had to say, and they were made it very clear that they were uncomfortable me being there. They wanted to know what I wanted to do. They made me feel very uncomfortable. They wanted me to resign, which I wouldn't. And and it was sort of left for about a day, and I thought, where's this going to go? And then I was called back, and so, you know, if you had any thoughts about the thing, and they said, we'd like you to leave, and leave quietly. And I said, well, but my accommodation's tied, you know, what am I going to do? And they said, well, short term, we'd just like to go sick for up to a year. There'll be no questions asked, and during that year we'll find you council house.
And so you and your first wife moved into
Yep.
a council flat.
Yep.
And you became a service engineer
I
of
did.
household goods.
When that happened, I felt broken again, but I was still reasonably well at that time, and I thought, I can pick these pieces up and start again. And I did, and I thought, well, how are you going to do? Hide it again? And I thought, well, you're going to have to do it. So we had plans. We wanted a family. We wanted a normal life. And I thought, well, I'm going to have to go and get another good job here. So I thought, I'm going to have to reinvent, basically, which is what I did. I went for another job, didn't tell them, got a good job. We wanted to buy a house. I knew you couldn't get a mortgage. I think that's no chance. Again, I'll admit it, I applied for a mortgage. I didn't tell them. I lied. I got a mortgage. And life went on for 10 years, I suppose, ticking along quite nicely. I was earning well. We had a family. And then my health started to suffer. I thought I was getting tired a lot. And I was struggling to do the job. And I'd gone up and I was training the engineers at the time. And I sort of worked the day around it. And I thought, you're not going to be able to do this for much longer. And I wasn't ready to throw the towel in. So I thought, well, what can you do? So I thought, you're going to have to reinvent again. So I thought, well, I'll leave and set up my own company doing exactly the same thing where I'm in control.
Before we talk about that, can you just describe for us a little bit more about the symptoms you were experiencing towards the end of your time when you were employed?
Fatigue was the main one. Tiredness, and it's hard to explain. It's a brick wall at 2 o'clock in the afternoon. It's not tiredness. Your body's just telling you you've got to sleep. Not you need rest. You've got to sleep. You've got to. I was driving around, and I knew I had to pull over, and I had to sleep, and then try and get through the day. That's where it started. It creeps up fairly gradually, and probably had been creeping up for many years before that. But that's the time I realised it's getting dangerous now, because you're working with electricity, you're working in people's houses. This isn't fair. The risk is getting too much. You can't carry on like this safely, and that's why I chose to leave that employment. Yeah.
So you set up your own business,
Yeah.
and it did very well.
It did,
to
yeah.
start with.
Yeah.
How did you manage your symptoms while you were running your own business?
Obviously, I was fully aware that my health was declining, and it was declining reasonably fast. So I wanted to be able to cope and manage my day. And so at that time, I had 2 young children, a mortgage still, and I knew it had to succeed. So I used to get up at 8 o'clock, and I made work till 11 o'clock, and I'd work hard and flat out. The business I had was a service engineer. I used to go around people's houses fixing cookers and washing machines, etc. I'd cram 4 in an hour, getting as close to each other, bang, bang, bang. And then by 12 o'clock, I'd just come home and go to bed, because I was exhausted. And I may get up at 7 o'clock for something to eat, and then I'd go back to bed again, and then do the same the next day, and that went on for years.
Now, you gave that business up during your treatment for the Hep C, which we will come to shortly. But can you describe the financial impact that the hepatitis C has had on you? Up until all the time I was working, I adjusted. I forced myself. I had to provide for my family. I had to. And I went for as long as I could and worked for as long as I could, but there got a point where I just couldn't work anymore. The fatigue was so much. Not only was I endangering myself, I was endangering other people by doing the job I do in it. So it was hard. And at the time where it was really bad, which was just prior to the Hep C treatment, that was the time I decided you can't work anymore. You're going to have to stop and throw the towel in, and I did. You've said my career and earnings potential was on target for an above average person,
Yeah.
and I'd have been able to provide financial security for myself and my family,
Yeah.
including pension arrangements.
Exactly, yeah.
Sadly, I can't do this.
No, what money I managed to save has obviously gone now. Yeah.
You didn't tell your children about your infection until your eldest was about 16.
Yes.
Can you tell us why that was?
Obviously, I'd seen it happen to so many other haemophiliacs. I'd seen the devastation that it can cause, the trauma throughout the families, the discrimination, the ignorance of some people, and how it can upset me. If it was just me, myself, I could cope with it, but I wasn't prepared to put my wife and my family, and especially my children, at risk. And so I decided, yeah, they knew it was a haemophiliac, they knew I had bad legs, they knew I had injections, they knew I had to sleep a lot, but I kept it at that. They didn't go into the full details. No.
You remained quiet because you didn't want your sons to be bullied at school.
Yeah, exactly, yeah.
You also tried to shelter your own parents from it.
Exactly, yeah. My coping mechanisms were I pulled into myself and thought, I know the truth. I know what I can do, what I can't. Why burden anybody else? Nothing's going to change. It's not going to change the past. It's probably not going to change the future. So I cope with it. My problem, I deal with it my way.
And so you only ever told people who were closest to you
Yep.
about your infection.
Yep.
But then 3 years ago you met your wife.
Yeah.
And you told her pretty much straight away about your
Yep.
infection. What was her reaction?
Absolutely amazing. I think she said, I don't know, you told me that. She said, but it makes absolutely no difference to me at all. Nothing. Which amazed me. Amazed me.
Before 2012, you were not offered treatment for your hepatitis C through the NHS.
No.
Can you tell us what you were told about this by the doctors?
Treatment was mentioned, of course we can treat your hepatitis C, we can treat your hepatitis C. Your liver is getting bad, we may have to think about. But they made it very clear because of my genotype that the treatment was very severe. The success rate was 60-ish%, and I was seeing other haemophiliacs going through this treatment and it nearly killing them. Sitting next to me exactly the same, and I thought, at the moment, until someone says to me, you've got to do it, or you should do it, I avoided it. And then I was getting mixed signals from the doctors, sort of thing. I couldn't figure out quite how serious this was. I knew my health was going down fast, and I still wasn't getting the sort of answers I was looking for from the NHS. So I started to research it, the beauty of the internet, and I thought these symptoms are looking bad. So I thought I want an honest opinion here, and I want a complete layman that's not going to be biased in any way. And I've researched it, and I saw this, the guy in London, Mr. Richardson, who I knew was Mr. Liver. He was the guy who pioneered the first liver transplant. He was George Best's liver specialist, and he had a practice in Harley Street. And I researched it, and they were doing an hour consultation, including scans and everything. You could just walk in off the street, and people did in London. They just walk in the street just to have a general health check. So I thought, what I'm going to do is I'm just going to book an appointment here and go there as a complete layman. I'm going to take all my blood results with me and ask him for an honest opinion, which is what I did.
And what did he say to you?
I'm amazed you're still walking, was the first thing he said. He said, looking at the results, I'm amazed you're still walking here. So I know a little bit about the scandal with the haemophilia thing. Why have you not been treated? I just don't understand how you've got this bad. I explained to him I'd researched the treatments, and the reason for me coming to him was for him to advise me on to what treatments were available, as to when they're available. The news for the new interferon treatments was just breaking. And he said, the problem with you is you haven't got time. He said, you need treatment within the year, otherwise you're going to die. And that hit me hard. I wasn't expecting that one. Obviously, they'd done scans and tests, and I thought, well, where do we go from here? So I've heard about these new interferon treatments. I was literally willing to travel to a different country to get them. And he said, they're not going to be on the NHS for at least 3 years. I said, well, how about privately? Is there any chance we could get them privately? He says, I'm not going to see them for probably 2. And he says, you haven't got that long. So I thought that's the final blow. This is it. He said, leave it with me. took the details. Obviously, my hour was up. I had the scans, had the results, went away. And within a week, I had a phone call from the Royal London. Saying we've had a referral from you, from Mr. I didn't know anything about a referral. He said, we'd like to meet straight away. So it was literally come on down sort of thing. So I jumped on the train and I said, we've been told that you need treatment straight away. We'd like to refer you to a drugs trial, to our trial unit. And at that time, they were just trying to support the Gilead Sabosprevir treatment, put me forward for that trial, and I applied for that trial.
So you couldn't join the Gilead trial in the end because of your medical condition?
I was turned down for, I applied for it, my hope was built up, I thought this is it, because they were saying this is the one that's going to cure you. Wait about a week, and they had the phone call and said, I'm sorry, because your liver's so bad, they won't accept you on the trial.
But instead you joined a different 6-month trial. You can't remember which drugs that involved,
no,
but you do know that it didn't...
A week later, the phone rang again. They said, we found another trial. Come on down again. So I came on down. They said, we found another trial that will take you. But they said the problem with this trial is it's still ribavirin and another drug, which at that time was a test drug and just had a long numerical number.
What were the side effects of that treatment?
It was made perfectly clear to me that this drug wasn't aimed at the UK market. It was aimed at the foreign market with people with a darker skin, because the main side effect was photosensitivity, sunburn. You couldn't stand the light. But I knew at that stage it was going to save my life, so I'd have taken anything.
And you did manage to complete the 6-month trial?
I did 3 months, yeah, with the side effects were, I say, it was designed for people with darker skin, and that's me, a redhead, fair skin. I had no chance. So literally, I couldn't even look out the window. You had to have factor 50 on indoors for 3 months. Blisters, like you couldn't believe. But I was determined to do it, and I did it, yeah.
And you cleared the virus?
Yeah.
Having cleared the virus, what's your health like now?
The damage has been done to my health. Obviously, the cirrhosis doesn't change. My liver's just still cirrhotic. It hasn't got any worse, and there are signs of improvement. I feel, in myself, I feel better now than I ever have done. But after clearing the Hep C virus, it takes time. It's not you clear the virus and within 6 weeks you're going to be feeling better. Within 6 months, you may start to feel marginally better. It takes 2 years before the energy comes back. I mean, I can go a day without sleeping through the day now. That's only been for the last 2 years. It takes time.
Before you started the treatment to clear the virus, you went to the GP suffering with depression.
Yeah.
And you went to see a counsellor.
Yeah.
I think you say you found that counselling helpful to you.
I did. This was pure. I've got an excellent GP, totally understanding, and he knows me, and he knows if ever I go to see him, I'm in trouble. I don't go there all the time. And I think I was just after a routine prescription for painkillers or something. He said, it's time for me to say to you, I'm only going to give you this prescription if you'll go and have counselling. And he said, I think it will really, really help you. I said, okay. And I went for a couple of sessions. And I think for me, it helped me because it was a complete stranger. I told her everything. And I'd never done that before to anybody.
You were also exposed to hepatitis B.
Yeah.
And you've received 3 letters warning you of your risk of VCJD.
Yeah.
In your statement, you've explained that 2 years ago you wanted to have ankle surgery at the Royal Surrey Hospital, but this was refused because of the risk of VCJD,
Yeah.
and you ultimately had the surgery at Basingstoke Hospital.
Yeah.
In a very recent explanation, the Trust have said that the reason why they couldn't undertake the surgery was because they received advice from your haemophilia centre that the surgery should take place there in the interests of your safety. Do you still hold to what you believe to have been the situation in relation to VCJD?
Absolutely, I do.
I want to move on to the issue of financial assistance. After you saw the private doctor, you applied to the Skipton Fund and received payments from them.
Yeah.
And you now receive payments from the EIBSS.
I do.
Do you have any particular views or experiences in relation to the process and nature of the schemes or the payments that are made?
for me, it was all done purely on blood results and scan results, and it was just done automatically. So I have no issues with it. It was done quickly when they received the paperwork.
You've said that you've got no problems. You've had no problems getting payments from the Skipton Fund, but you do think the payments you've received are unfair.
I do. It's not when you have a family. If they just took it as the average UK family, the average UK wage, the average working man's wage, I was earning more. I wouldn't consider myself as an average wage, and I worked hard to get it. And now I paid into the system for that time, and my earnings are about 20% of what I used to earn. What I get from things, it's barely enough to survive on. I'm still totally dependent on benefits now. I can't work. It's not particularly ideal now. I've remarried. I've got two young stepchildren, so we find it hard to survive financially on what's provided here.
Those are the questions I have for you. Is there anything else you would like to say?
I think one thing I would like touched upon is haemophilia treatment as it stands now. It feels we're penalised for our infections, where I feel we should be being prioritised rather than penalised. Whatever you do, wherever you go, you'll see the top. For example, when I had my ankle, and I researched this guy hard, and I knew he was the best. And he said, I explained to everything, Steve, I've got no problem. You're exactly the same to anybody else. I would operate on you tomorrow, but there's going to be a lot of red tape to go through. So I myself have got no problem. But as soon as it goes through, and it goes through to the different departments, you're flagged. We want to know more about this. We want to know more about the VCJD. We want to know, and it just doesn't. And this takes months. In my case, 2 years to actually come to fruition, and then they say, I'm sorry, we can't do it. And I was told before it had all been agreed. It was just a question if you say when you want it done, and I'll do it for you within 2 months. And when I said 2 months, 2 years down the line, they eventually said no. And it's not fair. You get exactly the same for dental care. I mean, we struggle for dental care, and if you can find an NHS practice that will accept you, which is hard, it's not great. But I found my personal thing, if you go to a private dentist, they're a bit keener, because they will say, we treat everybody the same. We use disposable instruments. You're the same as anybody else. But unfortunately, that costs a couple of £100. But it should be, if anything, we should be being prioritised through operations and general procedures rather than being penalised, which we are now.
I'm just going to turn my back and ask Mr. Snowden, who, as you know, represents you, if there's anything
Sure.
further. Just one point that Mr. Snowden asks me to raise. We were discussing earlier about the press story breaking in about 1983 of the link between haemophilia and HIV. Did the school ever say or suggest at the time anything about a link between the treatment you were receiving and HIV?
Not to me personally, no. Not at that time.
Thank you.
When you say not to me personally, do you happen to know from what other boys were saying that it was raised with them?
I couldn't speak for every haemophiliac there, but I think the general consensus would be no, not at that time. No.
Thank you very much. Steve, thank you very much for coming to give your evidence. That's it. But thank you. Ms. Fraser-Butlin, we are, I think, a shade earlier than planned. would you suggest that we begin with the next witness?
No, I suggest we take a break and start after.
Well, that seems very sensible to me. So shall we begin at, let's say, 1:45?
1:45.